Hi guys, my name is Saira Hussain and I'm going to present an analysis of the benefit and limitation of non-verbal communication in health and social care. Hi, now I'm going to introduce about non-verbal communication style. What is a non-verbal? Non-verbal communication includes all the types of clues you get from people that tell us how they feel without using words. We can assume a lot about a person and how they feel just by looking at their facial expression. For example, a person may be embarrassed if they are blushing, they could be angry if they storm, or if an individual winces or cries, they may be in a pain. Includes eye contact, the physical distance between individual, and posture, as in how people stand, sit, and lie down. A person's appearance can also speak for them. Nonverbal communication can also include sounds which are not speech, such as sighing, tooting, or sharp breath, meaning the body can do the talking for you. And now I'm going to guys tell you about importance of nonverbal communication in health and social care. Nonverbal communication works for both the patient and practitioners. Show warmth, care, genuine interest to the patient. Allows the practitioner to understand the needs that are unstated by patient. Sometimes they may not be able to or want to verbalize their pain, anxiety, or discomfort. By observing visible change, this can inform the practitioner of change in person condition, allows workers to gauge the sincerity of patient description of their condition. Now, what is the strength of nonverbal communication? Bridges gap caused by language differences, hearing loss, or emotional distress. Some nonverbal cues are universal, such as smiling or crying, meaning it can always be understood. Reduce misunderstand and promote smoother teamwork. By combining verbal and non-verbal communication, create a more credible messages, enhancing clarity. Can allow practitioner to quickly pick up on the non-verbal sign and assume what they indicate. Now I'm going to tell you what is the weakness of non-verbal communication. In a non-verbal communication, there is a risk of misinterpretation as the cues are ambiguous and interpreted differently across individual and cultures. Clarity limited, leaving practitioner guessing the patient condition. This means that practitioner could offer incorrect support for the patient, which can make matter worse. Practitioners need to be alert and attentive throughout, and some nonverbal cues could be overlooked or missed. Risk for personal bias, and practitioner may interpret it through their own emotional lens. Not suitable for trying to understand complex information. So, nonverbal communication cues alone cannot convey detailed care instructions. Physically barriers such as a face mask, physical environment factors such as distance or poor lighting can restrict observing facial expression and gesture. Right. Since nonverbal communication allow the patient to feel safe, building a trusting relationship where the patient feel respected and listened to during multidisciplinary meeting, and is valuable when working with clients who have speech, language, or cognitive impairments. Healthcare workers understand the patient true feeling and identifying their unmet needs to respond appropriately. Healthcare, being aware that eye contact, touch, and personal space varies across culture, healthcare worker do avoid misunderstanding. For example, in one culture, not making eye contact can be seen as rude, whereas in another culture it could be seen as a sign of respect. This means we able to apply it to many different sectors within health and social care, such as dementia care, mental health support, learning disability setting, end of life care, use where impairment limit. Within health and social care, multidisciplinary team play a big role in treating patients correctly. They involve a group of professionals from diverse fields who collaborate to achieve common goals. They combine their skills and deliver comprehensive, coordinated solution. How can we use nonverbal communication in multidisciplinary teams? Multidisciplinary teams rely on clear, consistent communication to coordinate and care. Using open posture, eye contact, nodding, or calm tone can encourage the quieter patient to contribute with group setting, makes individual support, collaborate decision making, and care planning. This team consists doctors, surgeons, nurses, physiotherapists, social worker, therapist, social worker, healthcare, who come together in meeting and combine their view and ideas, aiming to provide the best possible care for the patient and their families. Although nonverbal communication is very beneficial when trying to understand patient and their condition, there is still room for improvement to make sure patients receive the correct support. Firstly, by strengthening cultural awareness of different nonverbal cues, we can prevent assumption and improve trust, especially in diverse health and social care settings. We can also develop advanced observation skills. Better observation leads to more accurate assessment, meaning earlier intervention. Using structured communication tools to support clarity, reduce errors, support safeguarding, and make sure that non-verbal cues reinforce the verbal communication. Enhancing awareness of our own non-verbal behaviors. When practitioners are self-aware of their behaviors, they can adapt their communication styles when working with different individual or situation. From the research I have conducted when producing this presentation, I have concluded that non-verbal communication is essential for person-centered care. The strength outweighs the limitation when non-verbal communication is used appropriate. Critical for MDT team collaboration, supports safe, compassionate practice. Non-verbal communication is a fundamental part of practice in health and social care. In this presentation, I have demonstrated the key role of non-verbal cues in building trust, reducing anxiety, and supporting meaningful engagement with service user. Non-verbal communication behavior are especially relevant when working with people who may find it hard to communicate verbally. By continuing to refine our non-verbal communication skills, we can contribute to safe, more compassionate, and more collaborate for individuals. Now, You all really, thank you very much, all of you.